Currently, 1 in 6 Australians are aged over 65, and this will go to 1 in 4 in 2066. So 25% of the population will be over 65.
WA has the worst access to aged care in the country. We have some of the lowest ratios in the country for home care packages, CHSP and residential aged care. We're 2,000 beds short right now in residential aged care.
In a relatively short period of time, we're going to be funded retrospectively rather than prospectively. So the money that we are actually receiving needs to not only cover the cost of the workforce, but also the cost of compliance and the cost of innovating into the future.
We know when people step into care or step up into care, even if that's staying at home, that's an exposure point for 70% of people present with depression at that time. If we know those things, we can then start to go, well, we've got some capacity now. We can start to do things ahead of time, to be a little bit more proactive rather than reactionary. People accumulate medications or their doses aren't adjusted for the decline in renal function, etc., etc. And that provides risk factors for things like falls, amongst many, many other things. The opportunity to intervene when we know there is a step change in risk, I think is pretty important.
The way that we are now funded in the residential aged care environments is a degree slightly less sophisticated than the hospital system around recognising the waiting and the complexity. I think that's going to be really important in support at home, but it's not as sophisticated enough to pick up things like emerging dementia that is escalating over a period of 6 months with a rapid decline. If we could actually have a mechanism that aligned to the way that health does it so that we all understand it because we understand how health is done, I think that might make transparent some of the discussions we need to have about moving the funds that go with the person. And so the concept of TCP Plus or something similar might be additional clinical supports for some specialty services. It may be that it's additional care support. I think there's innovative ways that we can test models safely and have a go at it. One of the things that sits behind all of this is the need for escalation in and out of different parts of the sector. And that's where there's a real opportunity with technology.
There's nursing services, there's knowledge and understanding of dementia, there is mental health understanding and the understanding for when you might need to refer a person for additional services if that's required, wound care, medication management, ultimately palliative care, and the home care provider is also responsible for doing the case management for that individual. So what is the right mix of services and who's going to be providing that service, whether it's a service that's being provided by the provider themselves or subcontracted in some instances to an associated provider.